Namaste everyone, my name is Sankshita Zutshi and today we are going to be practicing Kapalbhati Pranayama. Now Kapal in Sanskrit means skull, Bhati means shining. So translated it means skull shining pranayam. Now why skull shining? You see, this pranayam has a very cleansing effect on the entire system. So if practiced over time consistently, it brings about good health and an inner radiance and glow to your face. Now who wouldn't want that? Now this pranayam is also effective in increasing our immunity. It detoxes the body. So the more toxins out of the body, higher the level of our immunity. Now this pranayam is also good for people going through constipation, acidity, gas. If you all have these issues, practice this pranayam regularly and it will help tremendously. This pranayam also cleanses the nasal passages. So anybody going through sinusitis, this will help clear off the excess mucus. This pranayam strengthens our respiratory system. It cleanses the lungs in a very big way. It strengthens our liver, pancreas, kidneys. It increases our metabolism. It helps in weight loss, yes. It strengthens the abdominal muscles. It strengthens the core in a very big way. And it improves the blood circulation. And yes, it is an anti-aging pranayam. It removes the fine lines and wrinkles off your face. Now, who all are not supposed to be practicing? People who have high BP, epilepsy, heart patients, gastric ulcers, hernia, women who are pregnant. In pregnancy, you're not supposed to be doing this pranayam. During your menstrual cycle, women who are on their period, during menstruation, you're not supposed to be doing this pranayam. And yeah, anybody who's had abdominal surgery recently, don't do Kapalbhati. So now this pranayam, now how should beginners do it? Now beginners, remember, you all are supposed to go slow. Don't rush into pranayam. I know there are a lot of people who do like 200, 300, 400 rounds of Kapalbhati, but they have built their way up and that's exactly what you're supposed to do. Now how to do it? Assume a comfortable sitting position and palms on your thighs. Shoulders roll back. Remember, never do any pranayam with a hunched back. Always keep your spine straight. Your shoulders, your chest, your back muscles, they will remain stable. So don't move them much because the focus is going to be on the abdominal region. Only this region moves. So active exhalation and passive inhalation. Remember this. When you exhale from your nostrils, your abdomen has to go in. Your abdominal muscles will go in. Remember the imagery, navel to the spine. So every time you exhale, the navel goes in. And the inhalation is very organic, very natural. Don't force the inhalation. Don't go like a... Okay, that's just wrong. Don't do that. And no, it's not effective at all doing it that way. Kapalbhati is not to be done that way. So it is active exhalation and passive inhalation. Let the inhalation be very natural, very organic. Let the body take care of it. Now, how to go about it? Just watch. I'm going to keep the palm on my abdomen so you get a visual exactly how it is done. Ideally, both the palms are on your thighs. So you will inhale, exhale completely. Take a nice full breath. Inhale once again. And begin. Breathe normally. Now as you saw, my pace was slow and I did only 10 abdominal pumps. Beginners, remember, you have to keep a slow pace. If you want to go even slower than this, go for it. If you're feeling lightheaded or dizzy during the execution of Kapalbhati, stop, take a couple of deep breaths and then resume. Like I mentioned, 10 to 12 abdominal pumps, 2 to 3 rounds is good enough to begin with. Intermediate practitioners, you all can go for 40 to 50 rounds, 40 to 50 pumps, 3 to 4 rounds, you all can do it definitely and build your way up. Same rule for you guys. You all can also do 100 to 100 but build your way up because Kapalbhati is a very strenuous practice. You are not supposed to be feeling lightheaded. You are not supposed to be feeling dizzy while doing it. So if you're getting any of those symptoms, even the intermediate ones, you might want to slow down the pace a little and get the rounds down. Don't do too many rounds of it either. So for you guys, you all can do it at a faster pace. So you will inhale, exhale, always take like 1 full breath before you begin. Inhale once again and begin. And breathe normally. When your breathing returns to normal, open your eyes. Like you saw, the pace was faster. I only did 20 abdominal pumps. You all can do more than that. So just gauge how your body responds. Learn to listen to your body. Your body is the best guide. So don't just do it because you saw some teacher doing it, you saw it on television. Don't do that. I know there are people who do like 400, 500 Kapalbhati, but they have worked their way up. So always start slow and then build. Now when to practice this? This is to be done early in the morning on an empty stomach. That is the best time to practice, and it is supposed to be done before your asana session because it is a shat karma. It is a cleansing kriya. So you first cleanse the body and then you get into your asanas. So it is ideally to be done before it. And if you're doing it in the evening, make sure there's a gap of 4 hours after your lunch, and then you can do it in the evening. Now, a general rule for everyone who's practicing any yoga style like an Ashtanga or an Iyengar practice, never eat immediately after your practice. I see a lot of people doing this. Don't do that. Keep a gap of minimum 30 minutes. Then eat something nutritious. So this is a general rule for anybody following any style of yoga. Keep a minimum gap of 30 minutes before you eat anything. You have generated a lot of energy during your yoga session, especially with the pranayams. Don't redirect that energy in eating something. Don't do that. So if you guys have any queries regarding Kapalbhati, please mention in the comments below and I will be happy to answer your questions. And yes, until we meet again, thank you very much. Namaste.